Good afternoon, everyone, and thank you again for joining us for today's webinar, Housing as Health Campaign Update from PA's History of Medicaid to Current State and Campaign Activity. Today's presenter is Patrick Keenan, Policy Director of the Pennsylvania Health Access Network. Patrick Keenan is the Director of Consumer Protections and Policy for the Pennsylvania Health Access Network. While advancing consumer-driven priorities like transparency, quality, lower costs, and expanded protections, he develops data and analysis to influence public support for expanding health care for all Pennsylvanians. He leads efforts to address the social determinants of health, enhance Medicaid managed care, improve coverage, and increase health equity. He built PHAN's statewide consumer engagement program to enroll thousands in coverage through data-driven campaign-style outreach and enrollment. He has a history of developing and managing human services programs and completed a graduate degree looking at evidence-based practices in behavioral health. Thank you for joining us again, and thank you, Patrick, for presenting, and I'll hand the webinar over to you.
So thank you, Colleen, and thank you for many of you who are on the call today. I see some familiar names and some folks who are new. So I'm going to begin by giving the caveat that, one of the things that we wanted to do is open up the conversation we've been having for several years now with members of the Housing Alliance and the broader housing community about Medicaid. But we also wanted to kind of recap some of the things that we've already talked about. So if some of the things that you're hearing for a second or perhaps a third time, I apologize. There will be time at the end so we can have further conversation about some of the next steps that we're taking with the Housing as Health campaign. But we did want to begin by kind of rediscussing Medicaid in Pennsylvania, how it's structured and who it serves, particularly because there's been a lot of changes to Medicaid over the past couple of years. Not only have we had the Medicaid expansion that Governor Wolf began, but we've also moved a lot of vulnerable individuals from a fee-for-service system into a new program called Community Health Choices. So we thought it was time to revisit a brief introduction to Medicaid and then move into some of the things that we've discussed on the connections between Medicaid and housing, and of course kind of cover where we are with the Housing as Health campaign and invite you to kind of join us in some of the next steps. So Colleen already gave a brief background into my work with PHAN, and I think that I'm always really impressed with the advocacy that the Housing Alliance does for the nonprofit housing community, and I think that what we do on the consumer side for healthcare is really kind of provide that same kind of level of support and detail to engaging Pennsylvania's healthcare consumers into kind of taking action. So we do both direct service to individuals and have a lot of community conversations and assist many individuals both, directly in their community, but also through our statewide helpline. We also really build up a solid base of information for individuals and partners to kind of take action in supporting better healthcare programs here in Pennsylvania. So that's a little background on the Pennsylvania Health Access Network and why we're here kind of talking about healthcare and housing. And so the first thing that, we wanted to cover in this was the overlap between Medicare and Medicaid. We're always asked these questions, about which program specifically are we talking about. So here in Pennsylvania, we have roughly the same numbers covered by both programs, 2.6 million in Medicare, 2.7 million in Medicaid. Medicare, of course, is covering older adults and adults with disabilities. And as many of you already know, Medicare is not an income-based program. So you pay into Medicare throughout your lifetime, and as long as you have enough quarter hours or have been able to get Medicare because of someone else's quarter hours, then you're eligible to participate in the program. Medicaid, on the other side, though, is an income-based program, and so Medicaid covers a large number of children. Nearly half of the enrollees, nearly half of that 2.7 million number are children. Covers pregnant women, caregivers to small children, people with disabilities, older adults, and then this newly eligible population. We'll talk about what a Medicaid expansion means for Pennsylvania because it's really the population that many housing providers are dealing with directly. Now, That being said, you can see some overlap in the two populations, generally around older adults and people with disabilities. Older adults that aren't eligible for Medicare can be, if they're income eligible for Medicaid, can be solely enrolled in Medicaid. And for folks with disabilities, it's often a big overlap. And you can see in the center that basically where people can have both Medicare and Medicaid, they can be enrolled in both programs, that's about 20% of the program. That's 1 in 2 Medicare beneficiaries also have Medicaid in Pennsylvania. And it's they have Medicaid because not only are they an older adult or an adult with a disability, but they also have a significantly lower income than most Medicare enrollees, an income that's below 100% of the federal poverty line or slightly above if they have some complicated health conditions, and they have very limited financial resources. So they need both Medicare and Medicaid to meet all of their health care needs. When we talk about Medicaid spending in Pennsylvania, I think before we kind of start, talking about the newly eligible population, I think it's really helpful to kind of put the populations in perspective. So as you can kind of see on the chart in front of you, you can see 12% of Medicaid enrollees are older adults, 18% people with disabilities, 35% are children, 8% are those caregivers to small children or other adults that were previously eligible for Medicaid. But Medicaid expansion covers, is 27% of the enrollment. The important part to really note as far as Pennsylvania state spending is it's the smallest portion of Pennsylvania state spending. It only accounts for 3% of Medicaid spending, state Medicaid spending in Pennsylvania. So what that means is often we hear that, the newly eligible, those eligible for Medicaid expansion, are taking resources away from others, from more vulnerable populations, and that's simply not true. You can see that, most Medicaid spending in Pennsylvania is devoted to people with disabilities and older adults. And of course, even children, who, like I said, close to 35–40% of the enrollees comprise 13%. So spending on non-disabled adults is very small. That's important because, again, Medicaid expansion is often the program that we hear, attacked kind of the most in some of these federal conversations or in our current, budget debates in Harrisburg. People are talking about, Medicaid expansion draining state coffers, and that's simply not true. To be eligible for Medicaid in Pennsylvania previously, you had to be well under the federal poverty line. Medicaid expansion raised that to 138% of the federal poverty line and eliminated the requirement to have a medical condition or to be, a very low income giver to small children. Resource limits do apply for adults 65 and older and for people with disabilities. So, to be in that dual eligible population, again, it's really kind of demonstrating that, you're kind of most at risk because of your lack of financial resources. And, most of those 2.7 million folks, the vast majority of them, 99%, give or take, are in a managed care program, which is basically the state pays for Medicaid, but it runs it through an insurance company to administer the benefits. And there's really, small numbers of populations. The biggest, number is 35,000 folks with autism, intellectual or developmental disabilities that are not in managed care. But managed care is really important because we're going to kind of talk about those programs next. Often for housing providers, you really need to be familiar with these 3 programs within Medicaid up on your screen now, but then there's companies that run each of these programs, and we'll talk about those on subsequent slides. So of the 2.7 million folks enrolled in Pennsylvania's Medicaid program, Physical Health Choices is the primary insurance for the largest majority of them, 2.2 million, and that is comprehensive health insurance that includes doctor's visits, hospital stays, prescription drugs, lab work, tests, the standard things that insurance covers for most individuals. No housing yet, and that yet part is a big part about why we have many of you on this call today. We do believe that there is a significant need within the Physical Health Choices program to cover some housing related services and supports. And any housing work that is currently being done is really being led by the individual managed care organizations, the individual companies running the Physical Health Choices program. It isn't being done because of a requirement at the state. It's more of something that these companies have kind of seen as a good thing to do. The Community Health Choices program, this is why we kind of needed to revisit some of the history of Medicaid, because between the last time we did this webinar and now, we've created the Community Health Choices program, and that covers, the remaining balance, that 420,000 folks, that receive Medicaid, who are also likely on, potentially on Medicare, but also getting long-term services and support. So this is, for those older individuals or adults with disabilities. It provides either the secondary insurance that they need to Medicare. Medicare is the primary insurance, and then Community Health Choices is your secondary insurance if you're a dual eligible individual. Or if you have special needs and you want to be able to live in the community, it provides for the long-term services and supports, or what sometimes are called home and community-based services. Long-term services and supports do include long-term care, so care in an assisted living facility or a nursing home. But there's been a big movement, and we'll get into more details about Community Health Choices, but there's been a big movement to move people out of institutionalized living, not just in the mental health community, but also in the aging community, so that people can age in place with dignity and independence in their own homes, which I'm sure all of us agree, is what we need to be doing. And, this is where we see the largest amount of housing activity occurring. The last program, and this is confusing because this kind of spans both of Physical Health Choices and Community Health Choices, but for behavioral health coverage, and that includes mental health and substance use disorder services. Most folks in Community Health Choices or Physical Health Choices have a behavioral health choice managed care as well. Those are driven by individual counties contracting with managed care entities to provide behavioral health benefits, because behavioral health has traditionally been led by the counties in partnership with the state. And here's where we also see, that housing is already occurring, but more housing is needed. We're simply not doing enough housing-related services and supports to adequately address the problems we see in our behavioral health system. So let's talk a little bit quickly about each of these programs. And I mentioned that we needed to familiarize ourselves with the managed care companies that run Medicaid. It's not just knowing about Medicaid, but also knowing that Medicaid is run by these companies, and these companies are often your first point of contact with the Medicaid system here in Pennsylvania. So you can see for the Physical Health Choices program, Medicaid is divided into 5 zones, and you can see each of those zones has at least 3 managed care companies or more running Medicaid. And participants in Medicaid can choose which managed care companies they're participating with, and they can choose to change their plan at any time. Pennsylvania has a really robust system of consumer protections designed to hold those companies accountable. So those companies are paid to cover those individuals. They're paid a capitated rate, which it means they're not getting more money if they have large expenses, and they're not getting less money if they have fewer expenses, but they're really trying to manage the money that they're getting. And so it's a big consumer protection for the consumer to be able to change at any point in time, because then the companies, have a little bit of risk that they've, paid out services, and, a consumer could decide to change. So really good aspect. But you should really be familiar in your areas with the managed care companies that are providing Physical Health Choices. As I said, there's no required benefits under the Physical Health Choices program to do housing-related services and supports, but many of these companies are looking to address the broader social determinants of health. They understand that housing providers are the folks that can help them do that, and they're very interested in seeing how they can work together with housing providers. Where we said there's more movement on housing activities is in the Community Health Choices program. And the Housing Alliance is doing a wonderful event that I'm sure you've already heard about in southwestern Pennsylvania, connecting housing providers with the 3 companies that run Community Health Choices across the state. So if you haven't already, if you're in the Southwest and you haven't already signed up for that event, I'm going to put in the pitch right there. It's coming up, and I'm sure Colleen or Lavana later on in this can remind you when that's happening. But basically, this was a big move on the state's part, 20 years in planning to start this program. And it finally went live this year in the Southwest. So 11 counties surrounding Southwest Pennsylvania, Allegheny County and its neighbors, went into Community Health Choices, and this will come to southeastern Pennsylvania, Philadelphia, and the 4 collar counties January 1st of next year, 2019. We'll come to the rest of the state in 2020, January 1st, so that includes the Northeast, Northwest, and central portions along with the Lehigh Valley. And to really accomplish the goals of Community Health Choices, these 3 companies, which are statewide, it's not like Health Choices that you saw on the previous slide where you're divided up into zones. These 3 companies, for now, are going to cover the entire state. These 3 companies are really interested in doing housing. Why? Here's that total population, that 420,000. You can see that the majority, 64% of them, are those dual eligibles, folks that have both Medicare and Medicaid. Those individuals are not getting as much housing as they need, and Community Health Choices doesn't necessarily directly address that need. That's part of the continued advocacy that we're going to talk about here in the Housing is Health campaign. However, for the 35%, that 150,000 folks plus that need long-term services and supports, there's a lot of housing attention being directed to them, because what we really want to do here in Pennsylvania, if you look at the bottom bar graphs, is kind of rebalance the kind of imbalance between folks living in a nursing facility and those living in the community under waiver programs. More folks are living in nursing home facilities than folks that are living in the community, 85,000 to 65,000. And part of the goals of Community Health Choices is to help folks that don't need to live in nursing home facilities, that don't require that level of care, and who could and want to live in the community, make that transition. And also to make sure that we don't see more and more folks kind of going into nursing facilities if that's not the appropriate place for them. So Community Health Choices has a lot to do with housing, and we'll kind of talk on on subsequent slides about how it can do even more with housing. What does it do with housing specifically? I mean, think about all the things that people need to be able to make that transition out of the nursing home. The supportive housing services that we've been advocating for are certainly a big part of making that transition. So finding and securing housing, and then having the people that will help people keep that housing in the community. But there's also a lot of things like home modifications or pest eradication. And certainly as we're looking for places to live in the community, the housing supply has to be really strong too, because if people are going to make that transition and they don't have their own home to modify, then they're going to need, housing stock that, is ready to receive them. So a lot of housing activity put, in Community Health Choices, and we want to do even more with that, dual eligible, that blue population that makes up the majority, because those folks are considered plain duals. Sometimes we hear them called healthy duals or community well duals, depending on who you're talking to. The reality is many of them are not healthy. Many of them are not well. They're kind of just on the border of needing long-term services and supports, and we really want to prevent them from sliding down into a state where they have to be placed in a nursing home facility. So that's going to be some of the continued and ongoing efforts, that we're going to be making on the Housing is Health campaign. The last of the three programs that we kind of gave the overview with on that first slide with the three programs is behavioral health choices. And so almost anyone that's in physical health choices or community health choices also has a behavioral health managed care company. There are 5 companies throughout the state, and there's only one company per county. The county contracts with or chooses to contract with a company, and it's one of the 5 that are listed on the screen. You can see it's not necessarily on zones. It's really just based on the companies that have a particular market share in an area, and those companies and the related counties are out there. Again, these are the companies that are, if they are doing a lot of housing already because of the fact that they're servicing people generally with serious mental illness. They're not doing so much on the substance use disorder side. These companies are doing it under supplemental services, and we'll talk about that on this slide. So under behavioral health Medicaid in Pennsylvania, these are the required services. You can see it includes a lot of inpatient or very serious levels of care, residential treatment, and for those under 21, rehabilitation services. So I mean, this does also include some of the things for children as well. And all of these companies have a separate list of supplemental services. So I hate both of these slides because it's a lot of text. There's no way to really pare it down. But what you can see in this slide is that they have to cover all of those intensive services. They can cover more outpatient or community-based forms of care under supplemental services. The behavioral health companies that are doing housing are kind of doing it under this optional supplemental benefits. And the goal of the Housing is Health campaign is really to increase and increase the amount of services that are being done in the behavioral health side, and really to make it a required benefit for particular populations, specifically those with the substance use disorder. So we've spent about 20 minutes covering a lot of Medicaid stuff, and it's before we move on to the Housing is Health campaign and some of the advocacy that we're going to be doing, it's probably a good time to kind of stop and see if folks have any questions.
Great. So if anybody has any questions, you can enter them into the chat box, but you can also unmute your line by clicking *7 to ask your question. Well, if there's no questions right now, we can continue, and then if anybody has any questions, just please submit them in the box, and we'll have more dialogue at the end of the webinar too.
Great. All right. So kind of moving on, we've got this robust system, and it's doing some housing already, but the question has always been, why is it not doing more? And it's interesting, speaking to a group of housing providers, I'm sure that you all understand at a very detailed level the connection between housing and healthcare. The perception that we've seen in the broader community is simply most individuals, most of the stakeholders outside of the housing and many in the healthcare community don't always understand this connection between housing and healthcare. Housing providers get it, healthcare providers get it, but some of the related community-based organizations sometimes, kind of struggle with how much housing should they do, and the general public really doesn't understand this. So I really, if you've seen this slide before, I'm not going to apologize because I think we can't talk enough about the data that we present here. So many of you have heard about the social determinants of health. And, what we need to keep on impressing upon people is there's only so much that good health care can accomplish. It's really that bottom 20%. If you look at the overall health outcomes that someone reaches in their lifetime. The care that they receive, having access to care, having access to quality care, really is only going to comprise about 20% or affect about 20% of their health outcomes. What makes up the rest of it? Well, there's the healthy behaviors, things like tobacco usage or your diet or exercise, other kinds of activities that you can control or behaviors that, we really want to kind of work to change. The physical environment has a big impact. The environment, that you live in, whether or not you have clean air, clean water, the basics to support life. But ultimately what we see is that 40% of people's health outcomes are controlled by socioeconomic factors. Access to housing is, of course, one of those biggest socioeconomic factors. It also includes things like education and access to employment, family and social supports and income, as well as the safety that, you have in your community. But, kind of housing is really at the epicenter of all of that because, as so many of you know, the housing that you have is determined by, the job that you have, about the supports, about your income, and ultimately that kind of determines some of those community and safety factors that play into there. So the core thing that we need to be saying is that if we're going to get to better health outcomes, we want to make sure that everyone has access to safe, affordable, equitable housing. And, why do we do that? Well, we can see that, if people experience housing instability, they're not going to be able to adhere to treatment plans. They're less likely to be able to self-manage chronic diseases. They're less likely to maintain consistent contact with healthcare professionals, and they're more likely to go to more costly forms of healthcare. We have to keep on saying this over and over again because, we all kind of get it from the folks that we service, but the general public just doesn't always understand this because the general public, generally, many of the audiences that we're talking to, that we're trying to get to influence or talk with their lawmakers, are stably housed themselves. And until you've kind of had a bout of housing instability or really, kind of lived in an unsafe or unaffordable housing situation, you don't get it. So we need to keep on ramping up how we talk about this. One of the gateways, as you all know, to getting to safe, affordable, and equitable housing is to provide supportive housing services. So folks that currently don't have that kind of housing need supports to be able to get there. And those are generally divided up into what we call pre-tenancy and tenancy sustaining services. So the things that people need to find and get into housing and the things that people need to keep that housing. You can see a list here that's generated under the past couple of years in collaboration with, or really with the Department of Human Services kind of leading a lot of this work. We've been able to kind of come up with a standardized set of pre-tenancy and tenancy sustaining services that programs across Medicaid should cover. And you can see the high-level points of those services. We want to and will continue to try to expand the limits of those services, and we think that there are things, more things that can be added that qualify as supportive housing services. But we've got a really good start, and that start has really been built over the past couple of years by many of you speaking up and speaking out to state officials, engaging in some of the activities that, the Housing is Health campaign has led. And so we, if you've done that, thank you. If you have yet to participate in the campaign, we really want to kind of point to this as a good example of things that have already been accomplished and the fact that progress really can be made by engaging the broader community. We should remind folks that we conducted a Medicaid crosswalk. Simply a fancy way of saying we looked at, those services, pre-tenancy and tenancy sustaining services, and we looked for the gaps, and we wanted to kind of find where there was alignment and where there wasn't alignment. And we developed a set of recommendations, 5 of them that are up on your screen that are fairly simple. One is to standardize or to explicitly, require across Medicaid coverage for pre-tenancy and tenancy-sustaining services. The second is to make sure that those with a substance use disorder, folks with substance use disorders right now can get very few supportive housing services, if any at all. And so we want to make sure that they're covered. We also want to strengthen, the supportive housing services for folks with a serious mental illness, schizophrenia, bipolar disorder, some of those conditions. But we also want to make sure that folks across the mental health spectrum get access to supportive housing services to support their recovery and wellness as well. And we want to make sure that if we're going to run this through managed care, which Pennsylvania does, that the state works with managed care entities to create models that really work for the provider community. And we want to make sure that the managed care companies work with the provider community to develop those partnerships, and that rather than just kind of give you guys a list and a map like I just did, that those managed care companies are supported in reaching out to all of you to make sure that we can provide these services. And the last and critical part to creating a sustainable system is making sure that we reinvest those savings. So we've kind of talked about the connection between why housing and healthcare work together and what we want to accomplish. And I think the question that people always ask is, well, it sounds great, but does it really have any kind of impact? And the answer is yes. We know that it does because of nationwide evidence that's been collected that shows people in supportive housing have far fewer costly encounters with the healthcare system. And when we looked at this at the Pennsylvania level, we saw, concretely that yes, it does cost money to provide supportive housing services. Nothing, housing providers cannot and should not be expected to work for free. So there is a cost to providing that benefit, but because individuals that are housed in supportive housing and have those services and supports to find and keep that housing, have fewer costly medical encounters, we actually, after we pay for those services, we see a net savings to Medicaid. So supportive services save Medicaid overall a lot of money, but when we factor kind of in paying for those services, we're still netting savings even after adding an additional benefit. We looked at a small subsample in our work in the campaign over the past couple of years of roughly 1,200 to 1,300 folks that are chronically homeless and have high medical expenses. And we looked at, what it would cost to provide the benefit to those, most vulnerable individuals and what we would save, and it was $1.47 million in state savings, nearly $3 million across the board, even after we paid for the benefit of providing or paid for the services housing providers would provide. It's a win-win situation across the board. So we've spent a lot of time talking to the 4 entities that run Medicaid in the state of Pennsylvania. And what we've been able to successfully accomplish, and this is part of a broader movement in the state, so we're glad to have been a part of that, the Housing is Health campaign, but we've really been able to kind of help craft those definitions as Community Health Choices was launching, and have those definitions be used to kind of underpin, the new waivers that the state was seeking to move from the old system into the new Community Health Choices system. So supportive housing services, as we kind of saw them defined, are being provided for those needing long-term services and supports. Some services are being provided to that larger dual eligible population, but it's not enough. And so we're going to really kind of continue to push the Office of Long-Term Living to really look at how they could better service those dual eligible individuals. Second accomplishment is, and this was well-timed because the Office of Developmental Programs that services those with intellectual disabilities and autism, and including developmental disabilities, was seeking, to kind of update, the waivers that they provide to those populations. That 35,000, if you recall, many slides ago that we were kind of talking about, and they did it. They included supportive housing services specifically in the updates of the waivers controlled by the Office of Developmental Programs. So we've got some solid wins there, but you can see in the middle of the screen, we've got some gaps, specifically on OMSAS, the Office of Mental Health and Substance Abuse Services, and the Office of Medical Assistance Programs. On the OMSAS side, as I mentioned when we talked about behavioral health choices, some activity is happening at the behavioral health level. Some behavioral health managed care organizations like Community Behavioral Health do a lot of housing, but we see a fragmentation across the state. We see, some counties doing a lot of housing, some counties doing no housing at all. And even though there's 5 companies and there's some consistency within those companies, there's not consistency in the system because each county is kind of dialing up or dialing down the amount of services it thinks it needs, often based on the funds that are available, and they simply don't have enough funds. So we're really pushing for Medicaid to cover supportive housing services on the behavioral health side and make sure that we're getting more federal dollars coming into the state so that we can have a more unified approach across the state. We also know that so many of you are servicing folks in that newly eligible population that may not have a behavioral health condition, or they have a behavioral health condition, a mental health condition specifically, that isn't defined as serious mental illness. And so we want to make sure that those folks, often served through the Office of Medical Assistance Programs under that Physical Health Choices program, have access to supportive housing services when it's a necessary intervention, when their condition warrants it, because they've got chronic communicable physical health diseases or because they've got something that's not a serious mental illness. So there's a lot of work to be done in those middle areas, and that's the work that we're going to be inviting you into over the next couple of months and over the next couple of slides. So to recap what we've already done under the Housing as Health banner, we've really been getting all of the data and all the resources that we've needed. We've had conversations across the state. Some of you that have participated in those conversations are on this webinar today. And really been working to understand the landscape of the housing and the healthcare connection. We have 89 organizations so far that have signed on to the campaign, and if your organization hasn't already done so, we're going to be asking you to think about taking that step moving ahead. We really want to look at the places where we've had success so far in the Office of Long-Term Living and the Office of Developmental Programs and make sure that those services are actually getting to the people that need them the most. But as we mentioned earlier, it's really important to make sure that we close the gaps and that we get supportive housing services for those with a substance use disorder, or those, make sure we have consistency for those with serious mental illness, and that we get the necessary supports to those that don't have a serious mental illness but still need the housing intervention. And the last thing is we can't forget about folks with just chronic physical health conditions, whether they're the plain duals and community health choices, or whether they're homeless individuals that don't have a mental health condition, but have diabetes, high blood pressure, other conditions that really benefit from that connection to housing. We want to make sure that they have access to the services that they need as well. So that's where we're going, and we've got new opportunities now. There's been some changes in the Department of Human Services in leadership, both with a new secretary and with a new deputy secretary of the Office of Mental Health and Substance Abuse Services. The new OMSAS deputy secretary is very familiar with housing and a strong supporter of housing, so we want to make sure that we have robust advocacy that kind of supports her as hopefully she moves towards adopting some of the recommendations that we've talked about. So with that being said, we're going to turn it over to Lavana, that's going to talk a little bit about how this actually works and what housing providers can do. and then we'll open it up to questions at the end.
Great. Thank you so much, Patrick. And I really encourage everyone who is not currently part of the coalition to sign up, and when we send out the follow-up email for this webinar, we'll tell you how to do that. So I just wanted to talk about a specific example of using supportive services to help keep people aging in place. And it's also a pitch for next week's webinar, which will go into more detail about how this specific program works. So next week we're going to be talking with American Healthcare Group, and they operate an innovative supportive service program that includes placement of a nurse coordinator at 20 senior housing developments across Pennsylvania. And the nurse coordinator uses health assessments, preventative screenings, and coordination of healthcare provider services to assist the residents to remain living independently and reduce their overall healthcare expenses. And the cost for these services is built into the operating budget for each property or is covered by grants, including healthcare companies or HUD. And so basically, the services of the nurse coordinator qualify as the hours of services that are required by PHFA in their contracts with different housing facilities. So it's just, if you are operating that type of property, there's an opportunity perhaps to add a nurse coordinator to your site, and that helps to keep residents healthy in place and reduce the overall healthcare costs. Just not to skip to the end and ruin the excitement of next week's webinar, but the model that they are using, on average, they estimate that it's saving $250 per month per person who's able to take advantage of it on their healthcare costs. So that's pretty significant, and that's what next week's webinar is all about. So if you want to find out more about how that works, sign up and join next week. And then I just wanted to pivot for a second to talk about what we can do as advocates to help move more waivers for these supportive services forward. So Patrick kind of went through that chart of the different types of waivers that we could get so that supportive services could be paid for by Medicaid. And the most important thing that we can do is to share with the agencies what you would do, how your clients would be able to take advantage of those supportive services and what a difference it would make in their lives. And so in the follow-up email for this webinar, we'll send you a form, and you can tell us like a quick summary of some example that you would like for the agencies to know about, and then we'll follow up and get more details on that. Because I think that those examples and stories of the real effects that housing services and supportive services for housing can have on people's health is what will help us to make the case and persuade them to provide us with these waivers. So I'll just stop there so we can wrap up.
Great. Thank you, Ivana and Patrick. If anybody has any questions, please submit them into the chat box in the bottom left-hand corner of your screen, or you can also ask your question by pressing *7 on your phone, and that will unmute you so you can ask a question.
So I'm just going to kind of mention here, and thank Lavana for kind of all the supports that the Housing Alliance of Pennsylvania, have given, and certainly connecting with all of you. I'm happy to, just in follow up. I know we covered a lot about Medicaid, and we did that intentionally, not to repeat it for some of you, and if you repeated it, I hope it was helpful hearing it for a second time, but really because we've learned that, both on the healthcare side, the healthcare providers that we have so many questions about understanding the complexities of the housing system that seems very Greek to us. And Colleen and Levana kind of reassured me that talking about Medicaid is really helpful because there's many folks that don't understand it in the housing community or just need it, again. So I know that it's rather complex, and I'm happy for any of you that are on the phone. My contact information is up there. If I can answer specific questions about the Medicaid program in your county or counties, happy to kind of dig into that with you to kind of understand how physical health choices, community health choices, behavioral health choices all play together. And also, if you have specific questions about how the participants in your program might be accessing Medicaid or what kind of benefits they might have, what we also know is that, there's a big knowledge gap there. So my contact is up there. Please don't hesitate to reach out. We really want to kind of demystify Medicaid, and sometimes the best way of doing that is just by digging into the individual situations in your program. So I put that out there as something that we're more than willing to kind of help out with. And if you think that there's other, if there's ways that we can connect in with any of the regional groups that you have, if there's ways that we can kind of support learning in your community about the connections between housing and healthcare, we're always happy to kind of get out from behind the screen and do in-person meetings where it's possible with groups of providers, or do other things. And as we kind of move into this next step of the campaign, we'll have additional things kind of going on. And of course, those stories really underpin the need for how this actually works and why we can save this money, because we need to kind of show the impact that's kind of going to drive those cost savings. So thank you, Levana, for kind of covering all those details.
No problem. Thank you so much, Patrick, for joining us today and reviewing over all of this information. As usual, the recording of the webinar and the PowerPoint will be available in the follow-up. And thanks, everyone, for joining us today.
Thank you, everyone, and have a great weekend.